I'm Dr. Chaitanya Rao, your Sinus Doctor. Today I'm going to talk about a disease which is competing with the COVID-19 for the headlines, Black Fungus, also known as Mucormycosis. I'm going to talk about why such an age-old disease is gaining such a prominence during this COVID-19 pandemic. So why are we seeing so many mucormycosis cases during this COVID-19 pandemic? In my last 10 years of private practice, I might have hardly seen 2 to 3 mucormycosis cases. But in the last month, I'm seeing almost 2 to 3 mucormycosis cases every day. So what is the link between mucormycosis and COVID-19? We already know that mucormycosis affects patients who are low on immunity. One more important factor which is essential for the growth of mucormycosis is high iron levels. COVID-19 ticks both these boxes. COVID-19 reduces the immunity of patients affected by it, and also COVID-19 has a tendency of forming blood clots. And these blood clots leads to destruction of RBC and release of iron from it. Apart from this, steroids are being used. Steroids like dexamethasone, prednisolone, methylprednisolone for the treatment of COVID-19 caused cytokine storm. Now, usage of steroids is a double-edged sword. Although steroid usage does definitely help in early recovery of COVID-19, it also reduces the immunity of the patients. Drugs like tocilizumab are also used for the treatment of COVID-19, but these also reduce the immunity levels of the patient. Now, in COVID-19 patients who are diabetics, the risk is even more. Diabetics have naturally low immunity owing to the diabetes. The stress from the COVID, the steroid usage for control of COVID, both leads to high sugar levels, and these high sugar levels sometimes become so alarmingly high that it leads to a condition called diabetic ketoacidosis. And in this diabetic ketoacidosis, there is a rise in the iron levels in the blood. So the combination of lower immunity and higher iron levels in the blood produces an excellent environment for the mucormycosis to flourish. Now, I hope you understood the link between the COVID-19 and mucormycosis and why such an age-old disease is gaining such a prominence, and we are seeing so many cases of mucormycosis during this COVID-19 pandemic. So,